will go ahead and get ourselves started. Our presenters today will be Scott Bookman, Director of the Division of Disease Control and Public Health Response, Dr. Sam Dominguez, an infectious disease expert at Children's Hospital Colorado, and Dr. Rachel Herlihy, State Epidemiologist at CDPHE. We'll get things started with Dr. Herlihy.
Great, thank you, Brian, and thank you to all of you for joining us today. So what we wanted to accomplish today was to provide you with a pre-holiday update on all of our viral respiratory infections that are being transmitted right now, provide you an update on the status of all of those, and then also provide an update on the number of invasive Group A strep infections that we've been seeing here in Colorado. So starting first with COVID-19 and our COVID-19 case data, you can see that our 7-day moving average number of cases is 852. You can see that our cases are down in the last couple of weeks. So we did see a peak in late November, early December here in Colorado. Numbers down since then, but you can see we're in a little bit of a plateau. So still seeing elevated case numbers, but a bit of a plateau in the last week and a half or so. So not seeing that steady downward trajectory that we were seeing a couple of weeks ago. And again, when we think about the types of viruses that are being spread right now, we continue to see the Omicron subvariants dominate, with increases occurring right now in BQ1 and BQ1.1, those newer Omicron subvariants, and seeing a decreasing proportion of cases that are being caused by BA5, which is the subvariant that was most prominent the last couple of months here in Colorado. Next slide, please. So moving on to our laboratory percent positivity data, you can see similar to our case data that we've seen a nice steady decrease in that percent positivity value down to around 9% right now. On the last couple of days, we have seen that value plateau, but again, a steady decrease from several weeks ago where we had our most recent peak in percent positivity. Next slide. Moving on to our hospitalization data. So you can see that we have seen a nice steady decrease in hospitalizations due to COVID-19 recently. So as of this week, we're at 339 individuals currently hospitalized here in Colorado, and that is a decrease of 56 from last week. Next slide, please. I'm moving on to some of our other respiratory viruses. So moving on specifically to RSV here, this is our RSV laboratory data where you can see percent positivity for RSV, and you can see that several weeks ago now we've seen a peak in the RSV values here and a steady decline. So things with RSV do seem to be moving in the right direction. Next slide. Moving on to RSV hospitalization data. Here you can see a very steep decline in the number of RSV-associated hospitalizations that we are detecting here in Colorado. And you can see that shown by that purple line, our current values are really now much closer to what we would typically see for a more normal RSV season. Next slide, please. Moving on to influenza. So you can see that we've also seen some positive news with influenza in the last week or so. You can see a nice steady decline in influenza-associated positivity. Again, this is our laboratory data. And again, a reminder that influenza is, of course, not a single virus. So we're separately tracking influenza A and influenza B here. And you can see that the vast majority of what we're detecting in the state is influenza B and has been for many weeks, and a nice downward trend in influenza A percent positivity. Next slide. So moving on to our influenza-associated hospitalization data. So here we're seeing a little bit more of a mixed trend. You can see that last week's data for influenza-associated hospitalizations here in Colorado, the value was 345 hospitalizations. And that's actually up a little bit from the week prior, but down from 2 weeks prior. So seeing some variable trends in influenza-associated hospitalizations right now. But I think most importantly, as you can see in the far left end of this figure, that red line showing our current influenza hospitalization count shows you that we continue to be well ahead of schedule for a typical influenza season. So much higher numbers than we would typically see at this time of year, though again, starting to move closer into that typical influenza season. And again, with these numbers kind of bouncing around a little bit, it's difficult to know if we're going to continue to see an upward trajectory like we saw from last week, or potentially, again, continue our downward trajectory. I would say also with the upcoming holidays, both for influenza, but also for RSV and COVID-19, as individuals are gathering more and we sort of change our normal patterns of behavior, there is also the potential that we could see cases and hospitalizations go up once again. So a reminder that the precautions that we've been using for the last few weeks continue to be important. Next slide. All right, so moving on to invasive group A strep and the data that we've been tracking around these invasive bacterial infections over the last couple of weeks. So just a reminder that group A strep is a bacteria that many of us are familiar with because it is commonly the cause of strep throat, an infection that many of us know very well. But we also know that group A strep can at times cause more severe infections and invasive infections. And what I mean by invasive is when the bacteria that causes these infections gets beyond places where bacteria normally live. So we all have bacteria living on our skin, in our mouths, in our throats, and our intestines. And when those bacteria get beyond those places where they can normally live and deep into our body, into these normally sterile sites, that's when these more severe and invasive infections can occur. So with the example of pneumonia, that is when the bacteria gets deep into our lungs. And then with some of these other examples, that's when the bacteria can get into our bloodstream or into deep tissue and cause some of these more severe infections. We know these infections are rare, but they are important. And of course, they have been increasing recently. Next slide, please. So as far as some of our case numbers, this is a table showing you the number of invasive group A strep cases that we've detected here in Colorado over multiple years, and showing you this data to show you our typical baseline for these types of infections. So you'll see the second column here shows you case totals for all age groups. And then the far right column shows you case totals for individuals under 18 years of age. And so you can see that 2022 is unusual in that we have seen a pretty significant increase in the number of these cases that are occurring in all age groups, really. And I think it's important to also remember that these are preliminary data. These are cases that are still being investigated, so these numbers can potentially change in time. But we're, of course, closely tracking these pediatric cases as well, because we know that these pediatric cases are much less common than we typically see these infections in adults. And we've seen this unusual increase since November 1st. So specifically here, you can see that Colorado has identified 13 of these invasive group A strep infections in our pediatric population since the 1st of November. So an unusual increase for us, more infections that we would expect to see. While these numbers continue to be small and these infections rare, these obviously are severe infections. And so with that, I'm going to hand it over to Dr. Dominguez, who's going to give us the frontline healthcare experience with these infections.
Thank you, Dr. Hurley, for the opportunity to be here today with you to talk about Group A strep. Again, my name is Sam Dominguez. I'm a pediatric infectious disease specialist here at Children's Hospital, Colorado. As I think everyone knows, this has been a very challenging and atypical year for a number of pathogens. In addition to the unprecedented surge of respiratory viruses that Dr. Hurley just talked about, here at Children's Hospital, Colorado, since about mid-November, we have seen an unusual increase in the number of patients being admitted with Group A strep. Next slide. I want to first point out, as Dr. Hurley already mentioned, that Group A strep infections in children are very common, but these infections are usually mild and are very easy to treat with common antibiotics. What we typically see with Group A infections are pharyngitis or strep throat. We also see scarlet fever and impetigo, which is a localized skin infection. So these are what we normally see every year in numerous cases in the community with Group A strep. Next slide. However, currently we are also seeing a more unusual severe type of Group A strep infection called invasive Group A strep. And as Dr. Hurley already described, this type of infection is presented in several different ways that we're seeing here at the hospital, including kids presenting with very severe pneumonia, sepsis, and this is when the bacteria gets into the bloodstream, toxic shock, bone, joint, and muscle infections, several kids with severe sinus disease, and then necrotizing fasciitis, which is a very severe type of skin infection. It's also very important to point out that while Group A strep is a bacterial infection, children with a respiratory virus like RSV, SARS-CoV-2, or influenza may be at higher risk of getting a secondary infection like Group A strep, either at the same time or shortly following these respiratory infections. Next slide. I also want to point out, as Dr. Hurley mentioned, that although we're seeing an increase in these cases, the number of them is still relatively rare. If you believe your child may have a serious bacterial infection, we want to encourage families to call their medical providers and to seek medical attention as early as possible. In particular, some warning signs to look for is if your child has difficulty breathing, is lethargic or difficult to wake up, if they're unable to eat or drink, if they're refusing to walk, if they have a rapidly spreading rash, or as I alluded to previously, if they have mild symptoms of a respiratory illness that suddenly get much worse. Those would be all signs that they should seek medical attention right away. Our team at Children's Hospital Colorado is well prepared to recognize and treat patients with Group A strep. We have a long history of recognizing and treating rare diagnoses. In particular, I just want to mention that tox-to-shock syndrome was discovered here at Children's Hospital Colorado by my colleague and mentor, Dr. Jim Todd. Children's Hospital Colorado works very closely with the state of Colorado as part of the CDC's Emerging Infections Program, and the CDC and the health department lean on partners like us to help with surveillance for these infections. Next slide. Caregivers and community members can help protect Colorado kids from a variety of illnesses, including Group A strep. And there are a number of preventative measures that we can all take. These include being up to date on all our vaccinations. While there is no vaccine for Group A strep, people should be up to date with their COVID-19, influenza, and chickenpox vaccines, as we do know that getting these infections can increase your risk of acquiring a Group A strep infection. We want to continue to encourage good hand hygiene and respiratory hygiene, staying home when sick, and considering wearing a mask when in indoor crowded spaces. We are extremely grateful to CDPHE and the partners we are working closely with across the state, including schools, partner hospitals, and policymakers, for helping to keep all our kids safe here in Colorado. I'll pass that on to Director Bookman.
Thank you, Dr. Dominguez, Dr. Herlihy, and thank you all for joining us here today. Today is the first day of winter officially, and it's already been a very long winter. And so I do want to take a moment to thank and recognize all of our healthcare providers, our first responders who are on the front lines every single day, taking care of our family, our friends, our loved ones, and we'll be doing that throughout this holiday season. And so I do just want to recognize all of their hard work as we work our way through this winter. And we are going into a very celebratory time of year. And after several previous COVID winters, we want to make sure that people know what they can do so that they can gather safely and celebrate the season together. And so first and foremost, obviously, stay home if you're sick. We know that there are a lot of illnesses going around right now. What might be a mild illness for one could be a very severe illness for someone else. And so it's really important to stay home if you are sick. Testing resources for COVID are abundant. Over-the-counter tests can be found in any number of locations. And you can go to CDPHE's COVID-19 testing site to get more information on where you can access testing resources like that. As Dr. Dominguez mentioned, getting vaccinated is one of the most important tools that we have in fighting these infections. And today is a great day to get your first dose. Today is a great day to get your Omicron dose and also to start getting your influenza vaccine as well. And so information on all of these things can be found on our website so that you can be prepared. Next slide, please. Again, I want to emphasize the importance of early testing and then accessing treatment if you test positive for COVID-19. There are antiviral therapies that are widely available that have a dramatic impact in decreasing the chance of severe illness or hospitalization from COVID-19. So test early. If you test positive, reach out to your healthcare provider so that you can get these incredibly important therapeutics. And then obviously good hand hygiene is an important tool in our toolbox for stopping the spread of illness. And then really thinking through, what is the right indoor and ventilation if you are having large groups gathering over the holidays. Maybe you can open a window or open a door if that's safe to do so. Really keep air moving. And so this information and many other things are available on our website. And we really encourage everyone to access that information so you can celebrate the holiday season as safely as possible. With that, Brian, I'll turn it over to you.
Thank you, Director Bookman, Dr. Dominguez, and Dr. Herlihy. We'll go ahead and move on to the media Q&A portion of this afternoon's press conference, we'll use the raise hand function that's located along the edge of your Zoom console. When it's your turn to ask your question, please state your name and outlet and unmute yourself. Please, we're going to start with first questions first. If we have extra time, we'll come back for second questions and follow-ups, and anything that was not covered on today's presentation or that we're not able to get to, please email us at media_info@state.co.us, and we will get back to you as soon as we can. Let's go ahead and get started with Meg Wingerter.
Hello, this is Meg from the Denver Post. I wanted to ask about with the holidays coming up. It seems like several of these respiratory things are headed in the right direction. Is there concern that if people kind of do things as usual, that might those might start rising again? Or do you feel like we have enough of a trajectory going that it's not going to probably be a huge issue? Thank you.
Yeah, this is Rachel. I can take that question. So, I mean, honestly, I think it's difficult to predict what the trajectory for all of these viruses is going to look like. I mean, I think we know that they are unpredictable in nature. We know that with COVID-19 over the last couple of years, we have sometimes seen multiple waves of illness, including back-to-back waves of illness. So that certainly is a possibility. We've also, from the last 2.5, nearly 3 years, around holidays, seen bumps in our numbers of COVID-19 cases and hospitalizations. So that certainly is a possibility. And so I think that's a really important part of the reason we wanted to share this information today, is to remind folks of the important strategies that we have to prevent transmission around the holidays. So taking those precautions that you heard about from Director Bookman, and of course, getting updated on vaccines if you are not yet up to date.
All right, let's go to John Daly.
Hi there. Yeah, thanks so much for taking our questions, and also thanks for all that you do and have done for all of us during this time. It's greatly appreciated, and yeah, thanks for taking our questions. I was wondering if you might be able to speak to folks' fears about, I guess this would be for Dr. Dominguez, about Strep A. You're hearing about cases in some other parts of the world. I think in the UK in particular has kind of generated some news. How rare is this? And then also, can you reflect on how unusual it is to be seeing what we're seeing now?
Yeah, I can start from, I think, the epi perspective on that, and then hand it to Dr. Dominguez. So we know that these increases have been seen in the United Kingdom and elsewhere in Europe. There are other states in the US that have also similarly seen increases. And I think we have lots of questions trying to understand what might be driving these increases. We know that the large number of viral respiratory infections that we've been experiencing over many weeks now here in Colorado and elsewhere could potentially be contributing. As Dr. Dominguez said, these viral respiratory infections can predispose someone to developing one of these secondary bacterial infections, including Group A strep infections. We also know that during the pandemic, we saw fewer of these infections. So when I shared that baseline data, you may have noticed that in 2020 and 21, the numbers were down a little bit. So similar to how we saw fewer RSV and flu cases in those years, we also saw fewer invasive bacterial infections like Group A strep. But I'll hand it over to Dr. Dominguez to see if there's anything he wants to add from his clinical work.
Yeah, I agree with everything that Dr. Hurley just said. I want to emphasize that these are very rare infections, that there are not very many of them, but they are definitely an increase what we've seen in the past. So I think that I want to give that reassurance to families and community members that this is still a rare infection. The other thing I would add is that Group A strep is a relatively easy bacteria to treat. And so again, emphasizing what I said earlier is that recognizing that your child is sick and getting into care as soon as possible is the best way to ensure that your child does well with one of these infections, because we do have good therapies for these bacteria, but we need to get them into care quickly, get them treated as soon as possible.
Let's go to Sarah Flower. Go ahead, Sarah.
Good afternoon. Hi, this is Sarah Flower with KSUT Tribal Radio. there have been reports of shortages of things like antivirals and antibiotics and other life-saving treatments. Curious how the state is, if they're seeing a shortage or what's going on from your perspective. Thank you.
I will start with that one, and then again, maybe I'll toss it to Dr. Dominguez for a very specific viewpoint from Children's, if you'd like to add in. But we are monitoring the situation. At this point, the state has not received any formal requests for support to help procure any type of medications or treatments that are in short supply. So we're just continuing to monitor it, talking to our partners, and have good lines of communication with our federal partners if any type of request would be needed.
I would just add that there definitely have been some shortages of antibiotics. That continues to be a problem. The good news is that for group A strep infections in particular, we have lots of different options. And so we've been able to pivot to different antibiotics that are equally as effective for treatment of group A strep infections. So that's not really a concern from our standpoint. And we've released guidelines to our community partners about other antibiotics they can use if they can't get the normal ones that they normally might use for group A strep infections.
Thanks. Let's go to Mensur Shaheen.
Hey, you guys noted that strep infections have been more prevalent this year, but are there any reports of the infection being more severe this year than in year past?
So I can have Dr. Dominguez comment on that from the clinical perspective as well. I think we don't have baseline surveillance data on all strep infections occurring. So really what we are measuring are the severe infections, these invasive infections that do result in hospitalization, oftentimes ICU stay as well. And of course, we've shared previously that 2 cases here in Colorado have been among children that have died. We know that those are still preliminary determinations. We're waiting for the official cause of death determination for those children. But these are certainly very severe infections, and those are really the infections that we're measuring. Dr. Dominguez, anything you want to add about your clinical experience in treating?
And no, I think what Dr. Hurley said is totally correct. Most group A infections don't require hospitalization because they're very mild and are easy to treat on an outpatient basis. So all the ones that we're seeing by definition are invasive and severe. And so that's not any different from previous years in terms of what we're seeing, the type of infections we're seeing and how severe these kids are presenting. It's really the number of them when we're seeing a lot more than we have in the past.
All right, let's send it over to Alex Edwards.
Hey there, thanks for taking my question. Technically questions, but I'm with the Denver Gazette, and I'm curious to know about vaccination rates for both the flu and for COVID-19. Where do we stand with those vaccinations? And then also, as far as hospitalizations, what has been the trend as far as severe illness goes with both COVID and influenza? If there's been any noticeable change, I guess.
I'll give a broad overview of where we stand with our vaccination efforts, and then we can follow up with specific numbers for you. But with our COVID vaccination work, we continue to be in the top tier of states for primary series and also for the additional doses. And then for influenza vaccine, we are doing slightly better than we did last year at this time. And so we would continue to encourage Coloradans to go out and get that influenza vaccine today to start getting your protection now.
And to your second question about trends and severity associated with influenza and COVID-19. So specifically for COVID-19, I would say that we continue to see a decrease in severity overall. So we believe a smaller proportion of cases resulting in hospitalization and death. And there's really multiple factors likely driving that. One is, of course, that we have immunity. So we have individuals that have been vaccinated, including now new Omicron booster doses. And there's some new good literature out showing the effectiveness of those Omicron doses in protecting individuals from hospitalization, but also individuals who've had a previous infection. And we know that combination of vaccine plus previous infection appears to be where people are most protected at this point. But we also know that the virus has been changing over time. So the virus has been changing and evolving in a way that allows it to be transmitted from one person to the next more easily. And with that, we believe changes in the virus have resulted in the virus causing less severe illness. So really, I think in general, we're seeing less severe illness. But to that, I would add that unfortunately, we do continue to see deaths here in Colorado. Most recently, we've been averaging about 5 to 10 deaths a day. So we know that COVID-19 continues to be a severe infection. And then the same thing is true for influenza. I think it's still too soon to know with this particular influenza season what severity is going to look like. We're really just still at the beginning of the flu season. We know that we're seeing more hospitalizations than we would typically see at this time of year. We're ahead of schedule for flu, but we don't know what the next couple of months are going to look like.
All right, let's go to Jaleesa Irizarry.
Hi there. We've got a multitude of illnesses going on, and I know we're in a downward for most of them, but with the holidays here and people gathering, which one should we be most worried about?
Take your pick. I don't know. I mean, unfortunately, they are all still circulating. I think the ones that I would emphasize, taking precautions for right now are those that we know we can prevent. So certainly getting your influenza vaccine if you haven't yet, and your Omicron dose or any COVID-19 vaccines if you haven't yet, because that's really where we have the greatest opportunity to prevent infections.
All right, do we have any other first questions in the room? All right, we'll go ahead and take a couple follow-ups. Meg Wingerter, you're up.
For taking my second question, I wanted to ask about, we generally had that pattern with COVID where you see the positivity go down and then a few weeks after that, the cases and the hospitalizations. So with the flu positivity going down, do you expect that to have the same sort of pattern, or are there some differences either with the virus or with our surveillance that we wouldn't expect that kind of predictable pattern? Thank you.
Yeah, I think that's a really great question, and a question that I've been asking too. And we, in fact, actually recently looked at some of the data out of Australia for last season to try and understand the trajectory of cases and laboratory positivity and hospitalizations in Australia. Because one of the things that we noticed in our data was that hospitalizations started to come down before our influenza positivity value started to come down, which is not what we've typically been seeing with COVID-19. And we actually saw that a similar trend occurred in Australia. So I think honestly, probably more questions for us to try and answer. I would say though that, I think the important takeaway here is that there's still a lot of influenza circulating, even though that positivity value has come down. There's still a lot of flu out there, and really the influenza hospitalizations are kind of bouncing around a little bit. So I think it's tough to know what's to come in the next couple of weeks.
All right, John Daly, go ahead.
Question about China and what's happening over there. I guess how concerned are you about what sounds like rapid spread there? And I guess it'd be too. It seems like it could affect the global picture and things here in the United States, either via other variants that emerge, whatever those might look like, A, and then B, potential impact on supply chain again if a lot of the population is sick and it affects the factories and some of the both medical like medications, but also things like masks and medical supplies. Or is this on your radar screen? How worried are you, and how worried should Coloradans be about that?
Yeah, so to the first question and what we are monitoring here in Colorado. So, we're closely watching trends in China and globally. I think one of the reasons that you mentioned that we track what is emerging and occurring elsewhere across the globe is to try and understand whether there are new variants emerging that could present us with new challenges. And really, anytime you have a large number of infections occurring, the more virus that is out there, the more opportunity is for the virus to evolve and for new variants to emerge. And so I think that's the scenario that I'm really most worried about when we hear about large outbreaks occurring internationally is the potential for new variants to emerge. And so we're closely tracking the global trends and really trying to understand if there are new variants circulating and what level of risk those could present to us here in Colorado. To the supply chain question, I think I'll hand that to Director Bookman.
Thanks, Dr. Hurley. Yeah, we certainly have learned over the last couple of years about how delicate the supply chain was. And how a ripple in one part of the world can impact everyone. And so, we're monitoring the situation carefully. And, what we do know is that we have built an enormous amount of stockpile capacity in this country and built an enormous amount of manufacturing capacity. And so we will continue to monitor it, but there are no concerns about supplies at this point.
All right, let's go to Sarah Flower.
I had a question about vaccines quickly. We're about 2 years out since COVID vaccines first became available in this country. And I'm curious about efficacy and what we've seen for the last 2 years of that. And also on that same note of the flu vaccine efficacy and what we're seeing with that being a match, particularly with influenza A. Thanks.
Yeah, so I'll start with influenza. So too soon to tell what vaccine efficacy is going to be for this particular season. We typically see the mid-season estimates come out sometime in January or February. So those official estimates not yet out, but the laboratory analyses that are being done are showing that the viruses that are circulating are closely related, and there is antibody protection that is being demonstrated with the circulating strains. So I think the laboratory data that we have so far is looking very promising, that we are going to see high levels of effectiveness associated with the influenza vaccines that are available right now. Again, we'll have the real world data in a couple of weeks and certainly hope to see some promising information there. As far as COVID-19 vaccine effectiveness, we actually just last week, there were some new reports out demonstrating the improved effectiveness associated with the Omicron dose. Some of those articles were published in MMWR, so encourage you to take a look at those. So showing that there is significant protection, both against infection, hospitalization, and death, including some really promising estimates around effectiveness of protecting individuals that are in long-term care facilities, which are obviously one of our most vulnerable populations.
All right, we'll take one more question. Back over to you, Meg Wingert.
Thank you. This one's for Dr. Dominguez. So it sounds like with these Group A strep infections, the invasive ones can have a lot of different presentations. So is it just, should parents just be looking for those signs of severe illness, which I guess could also be a lot of other things, but if you see those signs, come in and get it evaluated, find out which of these many things are going around it could be, or
yeah, that's a great point. So severe group A strep initially can look like other things as well. So other serious bacterial infections. And so the warning signs that I outlined are true for group A strep, but also true for some other serious bacterial infections. So for any of those things, it's recommended that you come in quickly for evaluation. Then once you get here, we'll figure out exactly what you have and make sure you get the right treatment.
All right, thanks everyone for joining us this afternoon. If there's anything we didn't get to or anything that was not covered in today's presentation, please email us at media_info@state.co.us and we'll get you some information as soon as we can. Thank you to Director Bookman, Dr. Hurley, and big thanks to Dr. Dominguez for joining us from Children's Hospital Colorado for today's presentation. And again, thank you all for joining. Have a great rest of your afternoon.
Thank you.